Demographic headwinds for adolescent residential treatment centers. How many potential clients are really out there? And by potential client, I mean age range 12 to 17, the right insurance that your center can work with, geographic proximity that they could come to your treatment center, a mental behavioral health condition acute enough to require a residential level of care, and the financial ability to cover costs and treatment even with private insurance. How big is that pool? Yeah, the numbers are not cheerful. I've talked to a lot of owners of treatment centers and executives. When they're not doing well, they're kind of baffled because there's such a need. We see these newspaper clippings every day about teen mental health getting worse and worse. Why, even though there's more competition in the space, why is it hard to find clients? Harder than it was, say, 5 years ago, even 3 years ago. And that got me really curious. How big is that pool of potential clients that treatment centers are competing for? So just by starting with how many 12 to 17-year-olds are there? What percentage of the population are they, both nationally as well as in California? Most of the treatment centers I work with are located in California, so they tend to have a majority of their clients come from inside the state. And then taking a look at just LA County as well. If you're in Southern California, probably a large percentage there. And it's a small number. It's just 7.8% of the US population, and it's 7.9% of California population, 7.5% Los Angeles County. And about 40% of 12 to 17-year-olds don't have private insurance. I'm looking at this data from 2021 and 2022 from the National Survey of Children's Health. Just north of 60% in the entire US and in California have private insurance to begin with. So how many teens actually need residential treatment? I found some interesting data that can offer clues. In the top left from the CDC, they reported that about 18.9% of 12 to 17-year-olds had received any kind of treatment for the year 2021. The reason that's particularly relevant is that we almost never see anybody come into residential treatment who has not interfaced with some form of treatment in the previous year, from having a school counselor to medication to psychiatric hospitalization. It doesn't really happen that they weren't seeing anybody and then landed in residential. So that's a very, very small pool of applicants to choose from that even could possibly move up. On the right, from the National Survey of Children's Health, they were looking at kiddos with mental, emotional, developmental, or behavioral problems, and they combined 2021 and 2022. In the US, it was 29.9% of 12 to 17-year-olds had at least one of those issues. California, even less, 20.6%. Then on the bottom left, this is actually all children, so not just 12 to 17-year-olds, and it's households reporting at least one of the behaviors listed below, not necessarily requiring therapy or medication. And then on the right, they broke it down by households and their insurance. So about 40% of households with private insurance reported a child having at least one of these conditions. Now, for out-of-network treatment centers, private insurance isn't enough. They need to have out-of-network benefits. It needs to have out-of-network benefits that can cover the cost of your treatment. And policies have been pulling back on that. Anthem is by far the most common provider, along with Blue Shield and Kaiser. We're seeing a lot more Anthems that have just suggested rate or even a max per day. So it's a PPO. It has out-of-network benefits, but it's only going to pay maybe $500 a day after the out-of-pocket, maybe $800. That still leaves the family with a massive financial responsibility to cover the cost of treatment. So how many families can actually afford treatment, whether out-of-network or in-network, even just covering a deductible, the out-of-pocket, travel, missing work for travel? You see in the top left, says that 7 out of 10 Californian adults are somewhat worried or very worried about their ability to afford healthcare. To the right, CNBC article from March of this year, 56% of Americans can't afford a $1,000 emergency expense. And then to the left, you see the median household income for United States, California, and Los Angeles County. So there's not as many people as you may think that have the ability to pull thousands of dollars, even $1,000, and put it towards treatment. So is it even possible to succeed? When looking at the data as a whole, it's pretty daunting. How many 12 to 17-year-olds live close enough to consider your center in a geographic proximity, require residential level of care, have insurance you can work with, and have the financial means to cover that expense? And that's just the demographics. That's not even considering all the other headwinds facing the behavioral health industry: inflation, interest rates, cost of capital, talent acquisition, labor costs, etc. So is it even possible to succeed? Should we give up now? Should we not open that new center? Yes, it's very possible. It can be done. Centers are leaving revenue on the table. There are potential clients who need quality care that they're not currently reaching, even though they're burning a lot of money, throwing good money after bad, hoping to turn things around, hoping something will stick. I'll cover this in another presentation, but yes, there are many actionable cost-free strategies that can be implemented immediately. Thanks so much for watching. I hope you found this information useful.